For those of your listeners who aren't familiar with cystic fibrosis, it's a rare genetic condition and it manifests in thick, sticky mucus, sort of clogging up a bunch of different organs, most notably my lungs, right? So that thick, sticky mucus basically becomes a paste inside my airways and it traps basically bacterial infections or some sort of irritant, and those infections over time sort of lead to a cascade of issues inside the respiratory system, which ultimately leads to respiratory failure and all the wonderful things that come with that. One of the weird things about CF is that 98 to 99% of men are born without a vas deferens, and that leads to infertility later in life.
This is the Man Up Podcast, the doctor's guide to men's health. Each week on our podcast, we interview the top specialists in the field on various topics in men's health. You have questions that you are too afraid to ask, we have the answers. This week, our episode is titled Perspectives, Talking Cystic Fibrosis and Male Fertility with Gunnar Esiason. I'm Dr. Kevin Chu, and I'm joined as always with my beautiful co-host, Dr. Justin Dubin. How you doing, brother?
I'm doing good, man. Kevin, you're the beautiful one today. You got this fresh haircut. Looking clean.
Man. It's, for the month of August, ending summer on a strong note. So, got
dude,
my
it is just too hot. It is just too hot here in Miami. It has been brutal, man. It's just, you're sweating if you just look outside. It's crazy.
Wait, so give me perspective, because, we lived there together, for 5 years. Has it been ever like this hot or no?
I will say that in the past, it's never really bothered me. Like, I would just go out and do whatever. But for the last 3 weeks, it's just another level. Like, I've been trying to walk outside and get fresh air. I've been doing a lot of outdoor activities. I take 2 steps outside, I feel like I'm going to die. Like, it's been another level. I think, if you don't believe in global warming, man, I don't know what to tell you, because it is just crazy hot. It's been really, really rough and honestly dangerous. I think it's just dangerously hot. Like, old people, we can't be outside doing anything. I can barely be outside.
So. Yeah, because I think back on all those years that when I lived in Miami, and now there'll be occasional days where it's sweltering, but never to the point we would still all go during the day we'd be like, hey, let's go for a walk, or go hang out on the beach, but never to the point that you're kind of explaining where it's so fucking hot that you're like, I can't be out here. I feel
you're right. And this is the first time. I've really felt that. And it is what it is, but man, it's crazy. Even going out on my balcony, I can't even stay on my balcony that long. I just start just sweating. It's like a sauna, but
I'm telling you, man, it's global warming, right, dude? In LA, it rained yesterday and it was 60s. Weird stuff's going on, man. Weird stuff's going on.
Dude, that's weird. That's weird.
Weird stuff.
Anyway, so back to the topic. I'm really excited for this guest. This was an awesome interview. And I think the topic is really, really important because, we've had someone on with another fertility issue with Klinefelter's, which, is one way that you can have a genetic disorder for infertility. Right. And this is another one. We're talking about cystic fibrosis. And a lot of people, for the longest time, we didn't really think that we didn't worry about fertility for men who had cystic fibrosis.
Yeah, you're absolutely correct, Justin. First off, this was awesome. It's been a while since we've done a perspectives episode. So it was nice to kind of bring that back into the fold. Really, at the end of the day, what Justin and I do, it's really about trying to improve, what we do in the podcast or what we do personally as doctors is try to improve people's lives. And so it's always nice to kind of just hear from on a very more personal aspect of that. Now, cystic fibrosis, lungs were always the big issues, when you're young. And so that's the kind of main thing that we focused on. And as you'll learn in this episode is that male fertility, as medical technology got better and, a lot of these patients are very fortunate to live much longer, fertility was one of the areas where it got impacted. And so, in this episode, you'll learn about basically how cystic fibrosis, how it can cause infertility, as well as how remarkably what IVF and a lot of these artificial reproductive technologies have been able to give these patients kind of a life that they never imagined they would.
It's pretty awesome. It's really amazing. And, cystic fibrosis is actually more common than you'd think. It occurs in about 1 in 2,500 to 3,500 white newborns. And so, approximately 1 in 30 Americans is a carrier, and it's a recessive trait. It really means that both parents have to be carriers for their offspring to have it. And, as we're talking about it, you'll hear Gunnar talk about, this mutation, CFTR gene is usually it's a defect in that. And usually what this protein is located in every organ of the body that makes mucus. So, including the lungs, as Kevin noted, the liver, the pancreas, the intestines, and the sweat glands. And so, when the CFTR protein doesn't work correctly, you get this thick, sticky mucus that causes blockage and can trap germs, leading to infections.
Yeah, and then, and importantly, when we look at it from the fertility aspect, so many guys come and see us to get vasectomies done, right? Vasectomies, which is basically we're trying to block and obstruct the vas. Well, in a portion of cystic fibrosis patients, they're born without the vas, so they essentially have a vasectomy that's done at birth, and so they can't they can't get that sperm out. Just to kind of rehash, the vas deferens are 2 tubes that are on each side of the testis and run out and basically deliver the sperm. And in cystic fibrosis patients, it's not there. That highway is not there. And so your sperm's being made, but it just can't get out the testis.
Yeah. So those are the things that we're going to highlight with Gunnar Esiason. And just a little bit about Gunnar. He's a renowned advocate for cystic fibrosis awareness and research. He's also the son of Boomer Esiason, a former NFL quarterback who's a well-known advocate for the CF community. And, it's very cool for me because growing up in New Jersey and New York, I listened to Boomer and Carton in the morning. Growing up, Carton's no longer on the show, but Boomer's still doing his show. And so I've listened to this. I've listened to Gunnar grow up. I've listened to, Boomer endorse the Esiason Foundation. And, it's been a really cool experience to actually kind of grow up listening to his father and then hear about Gunnar's story through his father and then actually talk with him today. And I think a lot of people in the tri-state area are very familiar with, obviously everyone's pretty familiar with Boomer, who does also, NFL analysis. But a lot of people in the tri-state area where I'm from are also familiar with the foundation. And so, Gunnar has really developed a patient engagement platform professionally for medical nutrition company. He's built a venture philanthropy practice at the Boomer Esiason Foundation and was the head coach of his high school alma mater's varsity hockey team. He's consulted on clinical trial development, a real-world evidence population health study, and a cystic fibrosis specific mental health and wellness screening tool. And he's really been the face of fundraising efforts for the Boomer Esiason Foundation, which has really yielded more than $160 million for the fight against cystic fibrosis since he was diagnosed with the condition in 1993. And, his blog has really amassed nearly 1 million page views since 2015. So if you want to talk about the face of cystic fibrosis, really, and the ultimate foundation for cystic fibrosis, you can't do any better than talking to Gunnar about this, his experiences, and go and donating to the Boomer Esiason Foundation, which we're going to be, their Instagram will be collaborating with us on when the podcast comes out on Monday. So, I'll definitely be donating to that foundation and supporting the cause. But it was just an awesome experience, and really want to thank Gunnar for coming on and really destigmatizing these conversations.
Yeah, it was a fantastic chat. It was fun. We talk a lot about his upbringing and things he went through. So I think our listeners are in for a treat. So let's jump right into it.
As men's health specialists, we know guys are shaving their balls. Yeah, we examine a lot of you, so we literally see it, but we also have the data showing it too.
That's right. According to research, over 85% of men trim their pubes. Not only that, but research shows that over 70% of women prefer a partner with at least partially trimmed pubic hair.
So guys, we know you're trimming the hedges, and we know that most women prefer you manscape. So if you're going to shave your balls, why not use the best men's grooming kit around? We're talking about Manscaped.
With the Manscaped Performance Package 4.0, you get the Lawnmower 4.0 with their all-new skin-safe electric trimmer that protects your balls from getting those cuts we've all had in the past. You also get the Weed Whacker 2.0 for trimming your nose and ear hairs. And let me tell you guys, we all need to do a better job of this.
Yep, that's right. Kevin and I both have the performance package, and we really love it. Manscaping has never been easier for us. And for our listeners, we have a special promotion. Go to manscaped.com and enter promo code MANUP and get 20% off your first purchase.
Go get your Manscaped products today. Your balls and your partner will thank you.
So I think let's just start off with cystic fibrosis in general.
Mm-hmm.
At what point, obviously you weren't alive, but at what point when your parents found out, did your parents find out you had CF, and then, and what changes did they make at that time to really accommodate you? Because I think it's important for both parents who have children with CF or may have children who are at risk for potentially having CF, as well as kids growing up with CF to understand these kinds of things.
Yeah, I interestingly, my parents were actually involved in CF fundraising awareness campaigns well before I was born, in fact, which is kind of a little bit of an irony. When my dad was the NFL MVP in 1989, he was sort of like America's guest that summer at this fundraiser, that fundraiser, this gala, or that gala. And at one in particular, a sports writer by the name of Frank DeFord, who you probably have heard of or probably know, was the keynote speaker. And he talked about his daughter, Alex, who sadly passed away from cystic fibrosis in the 70s. And, back then, the prognosis for people with CF was there basically wasn't one.
Right.
And it was a really heartfelt story. And in honor of her legacy, Frank, kind of was banging the drum for the CF community for a long time. And my dad and my mom happened to be at that fundraiser. And they went up to him after his talk and said, how can we get involved in CF fundraising and awareness? And said, when you go back to Cincinnati, my dad was with the Bengals at the time. And
right.
just, you can host celebrity lunches, celebrity dinners, visit kids in the hospital, that kind of thing. So my parents were very much involved in the CF community before I was born. And then finally, I was diagnosed when I was 2 years old in 1993. And my parents, had the unfortunate reality of sort of knowing a little bit about CF. And my dad always says that his first call was to his dad, my grandfather, and then his second call was to Frank DeFord, who said, we have an opportunity here to really put a face on cystic fibrosis. And by the time that I was born, there were a handful of treatments that people with CF could take. The prognosis is still not great. Patients were at the time expected to live maybe into their 20s or early 30s. To my parents' credit, they really try to give me as typical of a childhood as possible, right? Like they put me in sports, they put me in school. I had friends, I did activities, stuff like that. But the one thing that I think my parents always hung on to was that they recognized pretty early on that the care routine for CF is very active and arduous. I mean, it's pretty time consuming. There's a lot of nebulizers. Mm-hmm. And at least it was in the early 90s, it was that way. And they made sure that I was never doing it alone, right? I was always in the room with my parents doing my treatments, and it became a social time so that I wouldn't, resent it at some point later in my life. Kids will resist
yes,
all the best parts of medicine. So I think they were very aware that they didn't want that to happen to me, and they made my treatments and medications a social time. And they also were very aware, and still are today, that they didn't give me a choice when it came to putting a face on cystic fibrosis. And I think they felt like they had a responsibility with the platform they had, and the rest is sort of history.
Yeah, it's great.
I love that. I love that how your parents try to give you like a typical childhood and upbringing, as well as like all the support that they had to give you. Now, for some of our listeners who may not understand, what were like the earliest challenges to your health that you remember having to deal with?
Yeah, so for those of your listeners who aren't familiar with cystic fibrosis, it's a rare genetic condition, and it manifests in thick, sticky mucus, sort of clogging up a bunch of different organs.
Right.
Most notably my lungs, right? So that thick, sticky mucus basically becomes a paste inside my airways, and it traps basically bacterial infections or some sort of irritant, and those infections over time sort of lead to a cascade of issues inside the respiratory system, which ultimately leads to respiratory failure and all the wonderful things that come with that. That thick, sticky mucus, though, also shows up in my pancreas and my liver. And then one of the weird things about CF, which we'll get into a little bit later, is that 98 to 99% of men are born without a vas deferens. Right. And that leads to infertility later in life. So sort of like hitting the genetic lottery, I guess. And for me, it really wasn't, it never really occurred to me that I was different than my friends until I was about in first grade.
It's pretty amazing, though.
And I mean, I think it was, I was doing treatments routinely, and that is kind of what it was. And when I say treatments, it was, a handful of nebulizers in the morning and a handful of nebulizers before I go to bed. But as most people with CF experience, when the infection does take hold in our lungs, it can flare our symptoms pretty significantly. And we call that a pulmonary exacerbation, which ultimately needs to be treated with high dose intravenous antibiotics. And the first time that I ever needed an IV or intravenous antibiotics was when I was in first grade. Wow. And at the time I was getting my care at Cincinnati Children's Hospital. My dad was in the last year of his playing career. He had gone back to the Bengals after playing in New York for a few years, Arizona for a year, and then back to Cincinnati. So early one morning, they came into my bedroom. They woke me up. My mom and my dad did. And I could tell right away that there was something different about this morning. They were both super tense, but they weren't going to let on why. And they just said, Gunnar, we have to go to the doctor. And I said, okay, sure, that's fine. Just normal morning, I suppose. But on the car ride there, I could tell my parents were super, super tense until finally about halfway from our home to Cincinnati Children's Hospital, my dad, who was driving the car, turned around and looked at me and said, Gunnar, this isn't going to hurt. And he just offered that up. Damn. And as soon as he said that, I quickly realized that we were walking into something very different. Yeah. I mean, although I was in first grade, that's one of the things you never want to say to your kids. No. And for the rest of the car ride, he continued to insist, Gunnar, this isn't going to hurt. Gunnar, this isn't going to hurt. Gunnar, this isn't going to hurt. And now I'm also nervous and tense. Yeah. And then finally we get to Cincinnati Children's Hospital after 15 minutes of him regurgitating that saying over and over and over again. And instead of going to the Cystic Fibrosis specialty clinic, we went to interventional radiology, where I was about to get my first ever PICC line. So a PICC line is, basically, a semi-permanent or long-term IV that would ultimately feed the antibiotics into me. Yep. And it's done in a radiology suite, and for the sake of not getting too nuanced or technical, it's basically done under an X-ray. And and it's done in basically like a mini surgical suite, I suppose, is what I would describe it as. And so we get there, they strip me down, they put me into a hospital gown, and now I'm super tense, right? Like something is very different about this. And we're sitting on a gurney. My mom, my dad, and I are sitting on a gurney. I'm on my dad's lap, and I guess what is a pre-op or a waiting room, I suppose. And an anesthesiologist walks in and she says, "We can see that Gunnar's pretty tense, or we're starting to get a little anxious. We're going to give him something to take the edge off. We're going to give him some liquid Versed." And Versed, of course, is like a wonderful medicine.
It's like a Xanax. Yeah, it's like a Xanax.
Yeah, it's a wonderful medicine. And but I was in first grade, and there was no way in hell that I was going to be drinking any liquid medication at any point.
Oh yeah.
So for the next hour, I violently protested. I was not going to be touching. I mean, we're talking about a shot glass worth of medicine here, right? And I would not let that enter my body in any way whatsoever. So they had a rotating carousel of doctors and nurses and people coming in the room to try and convince me with logic to take this medicine, which I would not do. And after about an hour of backing up the cases for the day, the anesthesiologist finally walked back in, and she was like, Gunnar's going to have to take this medicine, otherwise we're going to have to put him out because this is really going to hurt him. And the moment she said that to me, I was like, wait a second. My dad's been telling me all day it's not going to hurt. So I jumped off the gurney. I looked at my dad square in the eye, and I said, "You lied to me." And I ran away. I ran out the door, through the lobby, and then into like the main atrium of Cincinnati Children's Hospital. And back in the room, my mom is sitting there, and my dad are just like, what the heck just happened? And my mom finally is like, Boomer, you have to go get Gunnar. So there goes the starting quarterback of the Cincinnati Bengals running through the atrium of Cincinnati Children's Hospital.
Amazing.
After his screaming son. And like, of course, everyone at that time remembers the Sports Illustrated cover. It's like, Father of the Year kind of thing. But in reality, behind the curtains, I'm running away from it. So finally, I get myself into basically like a dead end, I suppose. And there's a handicap railing. So I grab onto the handicap railing. And my dad to this day says that I had like the Vulcan death grip on that handicap railing. Like I just would not let go. And I'm crying, I'm screaming, the whole thing. It looks terrible. And my dad is like, Gunnar, you have to go back in there. Like this has to end. We can't do this. This is, you're making a scene. Everyone, this is not good. And finally he utters like the famous words, I will do whatever you want if you go back into that room.
Yes, that's going to do it.
So in that moment, I became a businessman, and I said, I'll go back in there if you get me a Nintendo 64. Those are my terms. I will go back in there in exchange for Nintendo. And he said, sure, that's fine. Like, those are the deal. Like, we will leave straight from the hospital. We'll go to the Toys R Us, and we'll get a Nintendo, and we'll call it all
amazing.
Fair. And I said, sure, that's fine. That's it. And I let go of the railing. We walked in, and I cried and screamed for the entire procedure. But they put the PICC line in. They started the antibiotics. And before you know it, I was the most popular first year in class with a new Nintendo. But I also realized in that moment that I was very different than my classmates, right? Like I knew that my classmates were not dealing with
these issues.
Like some chaotic morning in a hospital setting. And unfortunately, it also sort of colored the lens with how I interacted with my providers really for the rest of my childhood and early adult life.
I think it's so interesting. One thing I was talking with a friend the other day whose child has not cystic fibrosis, but had another congenital disorder that they were born with, and they were in and out of the hospital growing up. And I feel, as doctors, we often, see patients, and especially because we don't really deal with the peds end, and you kind of talk about this in your blog about like college and everything, it seems like for a lot of people, there's this aspect of control that you can kind of lose when you're going inside the hospital with your health. Like, how did you feel about that? Was there a period kind of like where you're like, I kind of don't want to deal with this stuff, and I just want to be like, I don't want to have to, take the medicines because I just want to just be one of the other guys. And unfortunately, obviously, we know, now, like, that was just, you need to do what you need to do. But have you struggled with that aspect in the past?
No. So I think I resisted in other ways, right? Like I never actually resisted doing my treatments.
Right.
Which is, some people do and some people don't.
Right.
For me, it was really, I saw my, the classic CF, care, like the nebulizers in the morning and then the nebulizers again in the evening. I sort of saw them as the gateway to the rest of the day, right? I could go to school, I could play sports, I could see my friends if I did my treatments in the morning, and then I could go to sleep if I did it in the evening. The way that I resisted, right, was whenever we went to the doctor. So, ever since that pivotal moment when I had that IV place in first grade, like it was just such a traumatic moment that whenever we went to get a flu shot or a blood test or, even a blood pressure reading, I resisted the entire way, right? And of course, in hindsight, looking back, it's a colossal waste of time, but because I would always been going through with it. But in the moment, there was never really any reason or logic that someone could, convince me of when it was time to go see the doctor. And, I don't know if I have the solution for what that is or if there even is a solution, but, I think nowadays, most of the providers in the CF world would have easily recognized that I was in some sort of mental distress. And that would have been the solution. But again, this was the 90s, early 90s. So it was a very different time.
Very different
world. And I think in those days, it was just kind of to rub some dirt in it and we'll get through this after you get your flu shot. But I think for me, the way that I really resisted my care was through individual medical encounters.
Yeah, that's interesting because I'm thinking back to the time when, in the 90s when I went to go see the doctor, and yeah, I felt like it was very different. Maybe, I don't know, maybe it felt different, but I was scared to go to the doctor when I was growing up. I was like, oh man, there's going to be a shot, Yeah. And I was like, I remember my parents would have dragged me in, and I was only getting like, just
typical care,
flu shots or, nothing like you were going through. So, so quick question, John, just something that you touched upon. So sports, and we'll kind of go into how cystic fibrosis can have kind of a variable kind of presentation. And not every single patient with cystic fibrosis will have kind of similar symptoms that they're going through. But in terms of sports, were you kind of like, I know you said you played in it, were you kind of restricted in any sort of way, or?
I think, it's funny in the 90s, right? Like my parents were just very diligent in, allowing me to do whatever I wanted to do. Of course, like my parents nudged me to their things that they liked, right? Yeah, which is I think what every parent does to some extent. So, when I was really young, I had a hockey stick in my hand and I learned how to skate, and, that was the dawn of my hockey career. I also played Little League baseball, played lacrosse, was a varsity athlete in high school, so I was definitely in it growing up. And we've come to, of course, learn in retrospect that turns out activity is very beneficial for people with CF, right? So exercise,
makes sense.
Physical fitness is super beneficial. So in some ways, we were just lucky that we were ahead of the curve in that way.
Yeah.
But
so you didn't.
Yeah.
Sorry. Go ahead.
No. Go ahead.
No, I was going to say, I mean, that's pretty amazing. And I just wanted to highlight that before, you go on and continue. Like, I think it's such an important point with activity in sports, because it's this idea, like, should I be doing something because I have something that could maybe predispose me to something else? And it's like, no, you got to put yourself out there, and actually, like, being active, there's kind of no excuse. Like, be active. It's going to help you at the end of the day. Like activity, exercise, being, physical activity it's so important for everyone. And I just wanted to highlight that. It's a great point.
You're right. I mean, I also think my parents were definitely having nuanced conversations, like, without me, at that time, right?
Right.
Like, everything was a micro decision, especially during like cold and flu season, which could exacerbate my CF symptoms. I mean, so, while I played football in high school, I was bringing all of my, my gear home every day instead of leaving it in the locker, so that it could be aired out. Like my practice jersey my mom could throw in the wash, or like I had 3 different mouthpieces so that we could wash them out and stuff like that. So, I mean, there were definitely things that we were doing to sort of mitigate any risk. Of course, you can't mitigate every risk. And in fact, I would get sick occasionally. So when I was a junior in high school, towards the end of the season, I started getting more playing time, looking forward to senior year, right? Like, as most kids do when the season goes one way or another. And it was awesome, right? Like, I remember looking forward to my senior year of high school football. I was a quarterback. I felt as though I was following my dad's footsteps and everything. And of course, around that time, Friday Night Lights, the movie, had just come out. So like everyone loved, the idea of like high school football, right? So, going into my senior year of high school, I developed mononucleosis, right? Of course, high school, illness, viral infection that everyone gets.
That's everyone's getting mono then.
And went around, I got it. I was no different. Yeah. And it basically exacerbated my symptoms so severely that I was dealing with pulmonary exacerbations all through that summer. The secondary effects of mono, and it was manifesting in so many different ways that like we felt like we were losing control of my CF, to the point when training camp started for my senior year of high school football. I mean, I had lost so much weight. I had basically, my muscle mass had declined, my pulmonary function had declined, but I was stubborn, and I was like, I'm still going to play football. Like, we're going to do this. This should work. But I mean, after the first or second practice, I mean, it was clear to my coaches, it was clear to my teammates that I wasn't who I once was, some 8 or 9 months prior. And I mean, I immediately lost a starting job, right? Like, it was clear to everyone that it wasn't safe for me to be playing at the level that I had previously been playing at. And, but I was stubborn. I wanted to put myself through it and give myself the best chance to compete as I could. Until one day we were doing conditioning where we were doing sprints back and forth across the field, and we would do push-ups and kind of repeat it over and over and over again. And during one sprint, I actually collapsed on the field.
Oh shit!
I went down hard. It was everyone's worst nightmare, right? Everyone knew that I had CF. Right? The coaches knew, my teammates knew. the trainer knew, the school knew, and everyone came running over, and I sort of came to, and I remember looking up and seeing all of my teammates, my friends, looking as if they had all just basically seen a ghost, right? Everyone was just terrified. And I finally picked myself up. I looked down and I saw that my entire jersey was covered in blood, right? I had suffered a massive hemoptysis on the football field. And again, everyone's worst nightmare, right?
Yeah.
So the trainer's running over, the coach runs over, they finally get to me. And I can realize that I'm able to breathe, right? Like, it's not like I can't breathe. So they're sort of asking me, what do you want? Like, we can call 911. We can, like, what do you want to do? And I was like, just call my mom. My mom will know what to do. And we called my mom. My mom came to school right away. And the next thing you know, we were headed into New York City for to go see our my pulmonologist to basically figure out what was going on. And it was one of the most difficult conversations that I ever had with a provider, because as soon as I walked in, it was clear that the treatment course that we had been pursuing over the last several months wasn't working, and we had to be more aggressive, right? And in doing so, I would have to basically give up my senior year of high school football. And I mean, within a matter of minutes, right? Like, I went from being like the big dreamer to thinking of myself as an athlete to all of a sudden the dream basically being taken away from me, right? By the conversation with the doctor, and also, my CF basically spiraling out of control.
Damn. So, I mean, like, how do you recover from that? Like, what was the next steps? Like, because obviously you're a high school kid, and like you just said, you were just dreaming, and then all of a sudden,
I was 17 at the time, and it was pretty, it was like a life hit you fast kind of thing. So we came home from the doctor, and my mom called ahead to my dad, who was back at the house, and was like, Gunnar got some bad news. Like, maybe you can talk to him or something like that. And I'm laughing because it's a little bit of a funny outcome. But so we finally got home, and, I kind of sulk into the study where my dad was. And my dad is like, I really wanted to say something to that, I've resisted. I haven't said it. I've not wanted to say it. But the truth is, like, you suck at football. Like, you are like one of the worst players in the team. And I like,
that's
the
amazing.
conversation.
That's
like,
amazing.
I was like took a 180. Like, I did not see that coming at all. And now, of course, I'm like forget my health. Now I'm like personally offended.
You're like, whoa, back up. Back up.
And like, he went on to say, like, you're a much better hockey player. You're a smart kid. Like, you're going to go to college. Like, these are things that you have to look forward to in life. And, I know that this one thing for you right now feels like it's the biggest thing for you in the entire world, but in fact, it's not, right? It's not even your best skill.
Great perspective.
You need to start thinking about the other things in life that you can excel at, and things that are going to mean a lot to you later in life. And he was basically insinuating that, give it up, start taking care of your CF. The only way to take care of it is super aggressively, what the doctor is sort of recommending. And, then go play hockey and then go off to college. And that's basically what we did. The more aggressive treatment course proved successful, and sort of abated the decline that I was experiencing my senior year of high school.
Yeah.
Wait, so then you went on and you played hockey?
Yeah, then I went on to play hockey a couple months later, and then
awesome.
And then that dream came to an end, as it does for most high school kids.
Yeah.
And then I went off to college.
That's amazing. I mean, that's, it's just reframing it and then taking another approach. I really appreciate that story. And your dad, obviously, that's absolutely hysterical. Now, I think the one thing we really want to talk about with you today is this fertility journey and the fertility aspect of CF. So for our listeners who don't know, men with CF have something called CBAVD, congenital bilateral absence of the vas deferens. And, the vas deferens, I like to describe it as really the highway that connects the testicle to the outside world, which sperm travel through. And in CF patients, the highway really isn't there. Sperm is actually being made, but it can't leave the testicle. It's basically trapped there. So even though CF patients have sperm, they don't have it in their ejaculate. It cannot achieve you, and you can't achieve a pregnancy through natural conception. And, years ago when CF patients didn't really live through adulthood, like you were talking about before, it never really was an issue, or people didn't really think about it. But, now that we know, as CF treatments have improved, we're seeing, CF patients and people live to normal adult ages, which means they also want to have families. And, one thing that you had done, and excellent job of is really highlighting this fertility struggles, your fertility journey that you and your wife went through to have your son. And, you even had the Family Planning Friday blogs where you highlighted other people. You had your blog and highlighting all these fertility journeys and people who have CF or who have children who had CF. So I kind of want you to just, tell us about what you learned about. First off, let's say, when did you learn about your fertility issues about CF? Did you always know about it? And, how did you first approach that situation with your wife, or did you even bring it up when you were starting dating? Like, how did you approach that?
Yeah, I think it's lots to unpack here, and we'll kind of get to a lot of it as much as we can. So it's actually interesting the way that I learned about it. You got to remember, I grew up in the era of, I guess we all sort of did, the era of social media where, come the turn of the millennium, like 2005, 2006, 2007, when I was in high school, these Facebook groups started populating for different disease communities, right? And CF is super unique in the sense that we actually can't be around each other, right? We can be around people without CF, but two people with CF can't be in the same room because we have these very serious bacterial infections that we could share with one another, right? Somebody who has healthy lungs isn't going to develop these infections.
Interesting.
So in order to meet other people with CF, in some ways we were encouraged to basically go into these online Facebook groups.
Interesting.
And the CF community is super vibrant online, active, say, on Twitter, on Facebook, and Instagram, wherever you can, on Reddit, all these places. Right. And I actually learned that I was infertile through a Facebook group, and it is to this day like one of like the worst learnings I think I ever had.
Crazy. Wow. That's crazy.
Yeah, you actually be surprised what sort of comes across in these groups, right? Like, I mean, there's really there aren't many secrets, right, about chronic conditions. And as a freshman or sophomore year in high school, it was terrifying, right? I was like, wait a second, I had not been told about this. Like, this is weird. And it wasn't, there was no easy way to like solve answers for me. Like, the internet wasn't then what it is today. So I, of course, started, conflating infertility with being sterile and all these different issues. Yeah. And as a high school kid, like, on one hand, you're like, okay, well, whatever, I'll deal with that later. But on the other hand, it sort of like was lingering in the background of my head that something was very seriously wrong that no one had told me about. And the classic, CF care guidelines suggested that at the time it was brought up, as kids sort of transitioned from pediatric to adult care around 18.
Mm-hmm. Makes sense, right?
So I had found out a few years prior. So I finally did have a conversation with the provider about it, and it still wasn't satisfying, right? It was like a quick 10-minute conversation that answered like no question. I was like awkward high schooler, right? I wasn't going to ask questions.
Right. For sure.
It's like, when you're 16 or 17 years old, they finally ask your parents to leave the room, and you can have the individual conversations with providers and stuff like that. But again, I was awkward high schooler. I didn't want to know anything more than I was being told. That was the end of it, So it really wasn't, I think, until my early 20s that I started to really kind of understand the gravity of it. And what would have to happen, right? I would have to have the sperm extracted through some sort of medical means, and it was like a terrifying like reality, right? Of course, like no one wants to have a syringe where the sun doesn't shine. So to me, it was it was just like something in the back of my head that was like a little like fear provoking. But also around that time in my life, in my early 20s, I was very sick, right? Like I had basically reached the precipice of end stage cystic fibrosis. So family building, family planning wasn't really top of mind. It wasn't a priority. Right. It was more just like survival. And then, of course, that all changed in 2018 when I got into a clinical trial for a drug that's now called Trikafta. And within 12 hours, I knew that I wasn't on the placebo when my CF symptoms started to abate, right? Like,
it's amazing.
I woke up one day, a week later, and all of a sudden, like, my CF wasn't gone, but it was like I could take a deep breath. I felt rested. I didn't cough. Like, I could go through my day without needing to do my treatments. Like, it happened so fast. That suddenly things that had been, packed away in, my mind, like fertility issues, started to resurface as my now wife and I started to talk more about family planning. So It definitely was a long journey to really kind of understanding what the implications of infertility were for men with CF. And there weren't really great answers that I was getting along the way.
You bring up a great thing that, I think Justin and I deal a lot with in the fertility world. As time goes on, we deal with a lot of patients congenital that, infertility is going to be a part of their life. And it's something that they're going to have to deal with. And now as there's a more multidisciplinary approach, it's really trying to identify when is that right time, which is still heavily debated. When's that right time to kind of bring into the fold to have these discussions? Mm-hmm. Because you're absolutely correct. When you're 16, 17, it's can be a tough time to discuss some of these kind of heavy issues. And so I don't know, Justin, I mean, that's one of the things that it's hard to figure out when exactly is the right time. But, the good thing is that everyone's working more together as time goes on.
Yeah, I also think that it's just one of those things where we're doing better at it. Like when we also understand now, like you said, Gunnar, cystic fibrosis patients, maybe we weren't having that conversation in the early 90s because we didn't have the technologies and everything and the medications for that family planning to really be discussed as much. But, I think that I don't know, you can tell us from your experiences in being active in the community, is that a conversation that's being told earlier? Because I think there's a difference between being told, hey, you don't have a vas deferens and you're infertile, versus saying like, hey, you may not just, you don't have these vas deferens, but you will be able to achieve for a family if you want one. It's a completely different outlook.
I think your point about like a multidisciplinary approach is important here, right? Because you got to remember that the person that leads the CF care team is a pulmonologist.
Yeah.
Right. Yeah. So like, that is a very narrow specialty. Yeah. And yet CF affects so many parts of the body that, these pulmonologists are trained, of course, to also understand GI distress, GI symptoms, respiratory,
pancreatic stuff too, and
things like that. So, of course, referrals are part of the process, but it's a lung doctor that's calling the shots. So, that's probably one sort of, if we're looking back retrospectively, like why this has kind of been an issue in the CF world, that's probably it. For me, like my perspective on when the right time to have the conversation is and how, it has to happen earlier than I think people believe it needs to happen, because you don't want people to run into what happened to me. And like that happens commonly, right? People, especially as kids, become so much more technologically savvy, and they get their information primarily from the internet and some medium, right? Like that's just a reality that we live in.
Absolutely.
So, these are conversations that need to be happening early, but they need to be happening delicately and with the appropriate support, right? Like you don't want to have a situation where the anesthesiologist comes in and tells me that I'm going to be in a situation that's going to hurt me, right? Like you don't want that. The appropriate staff members need to, trained staff members need to be there to support patients when they desperately need it. Typically parents, after they do get a CF diagnosis for their young kid, will learn, like my parents did learn, that I was infertile. Right around when I was diagnosed. And the conversation was kind of just pushed off until high school. So, part of, our foundation's efforts, the BEF family efforts, that's basically our reproductive health program, is to encourage these conversations to happen early. We plainly know that we're putting these things on the internet, right? And people are saying, kids follow our Instagram pages. And so that's, we have a platform, and we know that we are pushing doctors to have this conversation earlier and earlier and earlier, because we feel that it's one that people should have for a few reasons. One being that people with CF are living longer than ever, right? So these are things that people need to prepare about, need to be aware of, and it's something they can shoot for too, right? If you're a kid diagnosed with CF, you're dealing with lots of the issues that kids grow up with, but you're dealing now with the support of like breakthrough CF medicine. You have a lot more to live for than maybe we did 20, 30 years ago. So, yeah. There's a lot of calculus that goes on behind the scenes to really trying to, nudge the medical establishment to be a little bit more patient-centric, I think.
I love that.
Yeah, it's great. It's great.
It's great that you guys are, putting together like a platform with like good, good information, it's information that you can rely on. Just kind of touching on that, there is, Justin talks about it a lot. There's all this misinformation online, especially with social media now. You can find answers for everything, right?
Yeah.
And so, So from your perspective, have you had any experience sort of like, on just like how to find good medical information online and any potential concerns
well, I mean,
had?
I think everyone, of course, like, again, on the internet, we've all diagnosed ourselves with lymphoma through WebMD at one point in our lives, right? So
try going through med school, man. Every time you have a system, you're diagnosing yourself with something.
You're like, wow, that symptom is something that I've experienced for the last years. Maybe I should look at. So no, I totally get it. I think there's a weird fine balance, right? Like there's, I think credible organizations are really kind of the gold standard here, right? Like one of the truly the reason that we've had so much success in CF is because of the Cystic Fibrosis Foundation and how they've controlled the care guidelines, the science, the drug development pathways, the clinical trial networks. I mean, lots of things that go into advancing medical care for specific indications. So I think, but of course, these organizations, they get big and bulky, right? So things are slow, or they become bureaucratic for different reasons. So, patient advocates are essential, and especially for like rare unmet conditions, right? Like those are for sure really responsible for advancing the cause of their condition, but they need to work with credible organizations, and those are, I think, are conversations that, frankly, that just parents need to have with their kids as they grow up, in the context of cystic fibrosis or something else, right? They have to prepare their kids to use the internet more safely, appropriately. I mean, those are conversations that like the world is having.
All the time now.
That's just me pontificating on that.
yeah. But no, it's a really important point because we talked about it. We literally just recorded an episode that's coming out this week that about misinformation, understanding your health, how to go online and do accurate research. And I think obviously anytime you're especially when you're a community like you said with cystic fibrosis, where you're online is actually where the community is, it's really important. So I appreciate your insight there.
And now, I will say, like community members and patients support each other in a lot of ways, right? And I mean, we very clearly learned that as we were going through the IVF process, which I think we were about to talk about anyway.
Yeah.
And sort of the first part of family building for people with CF is to get the partner tested for the CF gene.
Yep.
That's the first thing. So CF is a recessive genetic order. So if you remember the Punnett square from ninth grade biology, like it's the big B, little b, little b. It basically you need two recessive copies to manifest in a positive CF diagnosis. So we had to screen my wife, and in fact, getting an answer on how to do that proved to be like one of the most significant challenges that we face.
Really?
Right, because there's about 1,200 different mutations that lead to the CF2 defect. That's the gene. Yeah. So what you don't want to do when you have a positive CF diagnosis in the family is screen for some of the most common ones, which is basically what people generally do when they hear about a CF screening. Like you need to do a comprehensive analysis, which is what we had to pursue. And getting an answer to do that proved to be a super uphill battle. At the time I was in business school up in New Hampshire. So my clinic at Dartmouth, they couldn't really give us a great answer on how to get her screened. My home clinic where I've gotten my care for the last 20 years at Columbia in New York City, they couldn't give us a good answer. So what do we do? We sourced the question to the CF community on the internet, and we found people that were knowledgeable. They knew what they were talking about, and they directed us to a genetic test, basically a for-profit genetic testing service, and that's how we had to rule out CF for rule out the CF. My wife being a CF carrier. So that was really kind of the first step in the process, and it was one where we learned very quickly that the classic CF care guidelines really kind of need to be updated to allow for people with CF to begin the family building process.
That's so interesting. And I think it's important to understand, like you said, and you highlighted, the CFTR mutation has so many different variations that can manifest as cystic fibrosis that even, I remember when we were learning about it in school, it was even like, like you said, the major ones, even if you're negative, there's no guarantee that you actually aren't a carrier. Now, so those are another reality, right? It's like there's like that little warning, like, just even though this stuff's negative, we don't know all of the mutations. So it's an interesting thing to deal with.
Yeah. I mean, again, we were also dealing with it without a genetic counselor, right? We were basically consumer health, for better or worse. And, I feel like I'm a smart guy. My wife's pretty smart. Like, and we were still kind of like walking through the dark a little bit, right? So it was the kind of thing that showed us that we were in for a long haul where we probably weren't going to be getting super concrete recommendations about really anything.
Yeah.
Gotcha. All right. Well, let's fast forward now over to when you're about to get the sperm extraction. Yeah. So now, for our listeners, so when for cystic fibrosis patients, because you're missing both vas, the way that we're able to, your testicles are still making sperm. So now you can kind of go in there, and with the advent of IVF over the past few years, now you can pull individual sperm out from the testicle or epididymis, and basically use this, to conceive a child. So during the sperm extraction, tell us about your experience. Yeah. I mean, me and Justin do this, but tell us about how that went.
No, so I'll say it was interesting, right? So I mean, as I've gotten older, I've become a lot more involved in care decisions, co-production, joint decision making between nurses and providers. So like anything that I'm going to experience for the first time, I like to understand as much about it that I can, so that I'm making the best informed decision for the best possible outcome. Of course, family building with CF is not exactly. I mean, people have been doing it now for about 10 or so years, or maybe even a little longer. But there's the information on outcomes is not good. So we were referred to a urologist by one of my CF providers, and it was during the pandemic that we were doing this. So we did a Zoom meeting. Immediately did not get a good vibe from him, and it was like a situation where okay, I fired the guy immediately. I was like, this guy's not doing it.
That's fine. Sometimes you gel, yeah.
He described the several different kinds of procedures that you could go through, from the TESI to the TESA to the micro-TESI to the PESA, all of these different things.
Yeah.
Mm-hmm.
And sort of described, different relative rates of success and stuff like that. And I got the sense that he was upselling me a little bit on going for something a little bit more invasive than I kind of had imagined that we would be doing. Like, I sort of had the idea that we were going to be doing it like a TESI situation, right? Which is pretty minimally invasive, right? That's just like some numbing, and then
you make a small window into the testicle, you take a little sperm out, and that's it.
Yeah, little sample, whatever, biopsies effectively. So, but I felt like I was being upsold on like something more of a substantial surgery, and I was like, this isn't right. I don't like this. So we then actually asked our fertility center, who had treated people with CF families in the past, and if they had anyone they recommended for us, and they recommended a urologist that was awesome. Like, as soon as we met him, completely different vibe. Like, he was like, I told him what had happened, that kind of described how I felt like I was being upsold and everything. He's like, no, all we need to do is the TESI. Of course, he had no data to back that up other than his anecdotal data of success, which, by the way, is something that's like we're trying to study, right, with our family building programs, right, is we want to make sure that we can give men with CF the appropriate information or
absolutely very
or
important
outcome information so that they can go forward and make choices. It's something that really hasn't been studied in cystic fibrosis specifically. So the TESI was what was chosen. We did some lab work to basically confirm or have a good sense that there was viable sperm that I was producing, because there are also other complications that people can run into with CF. Like, there might be some sort of idiopathic fertility associated with CF or unassociated with CF, or there's we take a lifetime of medicines. Who knows how all this stuff sort of interacts. So there's different tests that I had to do leading up to the actual procedure. And this procedure was something that I had like a deep-rooted fear of, as I mentioned earlier.
It's your nuts, man. It's your nuts.
It's not. Yeah. No. So I was like, and it's kind of a weird thing to talk about with other people. Other people have like presumably gone through it. But it was funny. I kept hearing like the same thing over and over again. It was like, it's the anticipation. The actual procedure itself is not that bad. So I finally showed up the day of, and I will say the first thing the urologist said, it was like a 7 a.m. case or whatever.
Yeah.
At the clinic, and the first thing the guy said to me, who was like, actually, this isn't going to be so bad. It's very easy to numb. And I was like, I would have loved to hear that 10 years ago, right? Like, that, maybe you lead with that, like, don't lead until the day of.
Yeah, that's amazing. That's amazing.
So, but I'm also, by this point, I've also taken like 100 Valium, like I'm like, what I'm saying? Like, so like I'm like floating through the clinic. So we finally get there, and the guy happened to be from Maryland, where my dad went to University of Maryland, played football at the University of Maryland. So we started talking, like, of all things, started talking about college lacrosse. It's one thing that every person I've talked to with CF that's gone through this, they always remember the conversation they have with the doctor while they're going through the procedure. And he and I talked about college lacrosse of all things. I remember feeling it really wasn't so bad. Like, it was very, very quick, very easy, mostly painless. Of course, I walked around like a penguin for 3 days afterwards, but and also the 2-hour car ride home was horrendous. That sucked. That was really probably the worst part of the whole thing. But yeah, it was pretty easy, pretty painless, pretty quick. I guess the weirdest part about the whole process is when I was in recovery, so to speak, they brought out the sample that the doctor had extracted, and he handed it to my wife in like a cooler. Yeah. And we had to drive it from the hospital
to the IVF center,
across town to the fertility center. And like that was like the weirdest part of the whole thing.
It's also so I think you really that was a really awesome description and a great perspective. And just to highlight a couple of things there, just going back to the procedures, I think, just to give people perspective. So a TESE is a testicular sperm extraction, and that's kind of just, you can do that while you're in the clinic. You can do it sometimes. Some people don't want to be awake at all, so you can go to the OR for that. The TESA is a sperm aspiration, where sometimes you can just take a needle and you can suck it up, like they stab your testicle and then they pull out some tissue.
It's a big needle.
It's a big needle, but we numb you up. And then the micro TESE is microscopic. We do it under the surgical microscope. Now, obviously there's a lot of decision making. There's shared decision making to be had. Some people, prefer to do the micro TESE. Some people don't. But the success rate in general for cystic fibrosis, and honestly, I think I would love to work with you on that data. That sounds awesome to put that data out there. The success rate just, I don't know, is usually very, very high, like for these procedures. And that's why, like doing it in the clinic, getting the small window, getting the tissue is a very good option. And the other thing that I think is important to highlight here is that, when we're talking about family planning, it's important to understand that when we take the tissue, it can only be used for IVF. You cannot conceive naturally when you have cystic fibrosis because, obviously, we have to go to the testicle. We find the sperm in the tissue in the IVF center, and they're, putting that with an egg. So it has to be through IVF. So that's something else that I think couples really need to understand. And actually, that's a good thing because, they can do some genetic testing on the eggs and everything as well.
Yeah. So, I think it was, you're describing exactly how I felt, right? Like I knew that once they had identified that I had, or they basically identified a high likelihood that I had viable sperm that followed the lab testing.
Right.
I felt comfortable with the TESE, right? I think some people just kind of want to do like a one and done kind of deal, right? And they'll go for the micro TESE option, so that they know that they never have to do it, right?
Right.
Like I think there's, of course, you hear anecdotal situations of people kind of having one sort of outcome versus another, and people love to talk about bad outcomes on the internet, right? So
absolutely,
that's something that
for sure, that's their favorite topic.
It's like go to Yelp,
exactly.
It's like everything's either amazing and it was the greatest thing ever, or like it sucked and it was the worst day of their life.
Worst.
Right.
Success in this case is like probably a 3-star situation. Like never gonna hear about that.
It's a great way of looking at it. It's true.
So, I think for us, we try to make situations that were both quality of life based, but also highest chances of success, and that's how we thought about it.
Yeah.
No, that's great. So, if we take a step back now, you've gone through so much in your life, and thanks so much for sharing a lot of this with us. What advice would you give to couples, with a partner with CF and they're starting a family process? Like, what would you recommend to them?
So, I think the things that we kind of, I guess we haven't really talked much about the other part of the IVF side, right? My wife's side of it all. And for all intents and purposes, the sperm extraction is probably the easiest part of everything.
Absolutely.
It's like everything that, everything my wife had to go through was 10x more difficult.
Oh yeah.
I think, from day one, looking back, we did budgeting because we knew that her part was going to be basically all out of pocket. And we're fortunate that we were able to afford it. And we're also fortunate that we had, relatively quick success, meaning the cost of the entire IVF cycle was lower for us. So that's something that whenever I talk to someone about IVF, that's the first thing that I kind of say is, right, like, you need to know that you can afford it, understand what your insurance situation is. If you're working for an employer that has, fertility benefits, awesome, then, that becomes less of a stressor. But that's really got to be step one. I think for us, for number two, it was, I started having candid conversations with my providers, right, my CF doctors, to basically tell them, I was like, we're starting to think about family building. I want to know how I should expect for my care routine to change. What should I think about as far as, preserving my health? Because although I'm on Trikafta and it's been remarkably effective, I still do have CF, right?
Right.
So there are some, considerations that need to be made, and we wanted to be able to plan for as much as we could ahead of the, our child arriving into our home. So we had, sort of long conversations about sleep considerations and about, daycare versus home care versus, all these different things. I feel like today we're still making a lot of micro decisions that just pop up. So those are really kind of the piece of advice that I would have is, right, you really got to talk with your partner. You got to budget. You got to find someone you're comfortable with. Right? I had to find a urologist that I liked. Yep. My wife had to find a fertility center that she was comfortable with. And I wanted to make sure my CF providers were on my team. I will say the one thing that we did was we didn't tell anyone that we were going through it. So at the time, my wife and I were engaged. It was the pandemic. We were living in New Hampshire because I was in business school, and we were getting married in June of 2021. And I forget exactly how the conversation happened, but they're like, "Wouldn't it be cool if we just surprised everyone at our wedding with a pregnancy announcement?" And sure enough, everything kind of went according to plan, and we were able to tell all our friends and family at our wedding that we were pregnant.
That's amazing. That's so awesome. That's
so. I mean,
awesome.
if you like learn back, remember back to June 2021, it was right kind of like when the world started opening up, right?
Yeah.
So it was kind of a cool thing that, no one will ever forget it. We certainly won't. But it was a really cool way to sort of have some icing on the cake. But the whole fertility process that we went through was long. It was still lots of little micro decisions. And the best way to I think approach it is to really just kind of talk through as much of it as you can before it actually starts to happen.
It's great points. Really, really good points. And I think the point that, especially when we're talking about, here, men's health and guys getting the help they need. I think one thing you highlighted here is really, that IVF process for your partner is so intense. And we've talked about this on the pod before. Like, the least you can do, even as a guy, if you're worried about your fertility, is go talk to a doctor about it. We know that about, even only 30% of guys who are concerned about their fertility will actually talk to a doctor about it. So, they're just not doing it. And when you've seen, even from your perspective, what women do, the least you can go do is talk to your doctor. And you just said yourself, you literally had your nuts cut open and you're like, oh yeah, this is like nothing compared to what my wife went through for IVF.
Yeah, no, it's true. It was, there's just a slew of medications that are designed to do one thing, right? And to change hormonal balances and a lot of different moving parts. And as someone, I've taken a lifetime of medicines, and I've never taken anything quite like what she had to go through. So, it was definitely, she had the more challenging part, but I think the determination to have a good outcome, right, is what leads most families through it.
Yeah, that's so awesome.
Yeah, our first child was through IVF. I didn't get my nuts cut open because I just had to ejaculate into a cup. So, but I saw the process. It's all the shots that your partner's going through. It's tough, and you're just kind of like,
I will say once the search and rescue mission to my nuts had passed, I think I felt like the hardest part of that was over. I think when you go through the IVF part, it becomes more emotionally draining on the male partner. But I will say, I felt like my CF prepared me for that. in some ways, because I've just been confronted with uncertainty and questions and probabilistic thinking my entire life that it just sort of felt like it was very very natural as we were kind of going through. At least that's how I dealt with it. I think for better or worse, I suppose.
No, I hear you. Now I want to kind of change the question. We talk advice for parents thinking about, family planning. If one of the couple, if the male has cystic fibrosis, what advice do you have for, coming from someone who has cystic fibrosis? We talked about growing up with it. For parents who have a child with cystic fibrosis, what advice do you have for them?
Yeah, I think in the context of family building, I think it's important to have that conversation early, right, with the doctor, with the provider, and to basically reaffirm that it's possible. I think for us it was a little taboo because I found out through the internet, which wasn't great. But it's something to just be upfront and candid and trustworthy about. I think as far as success, that's not something that kids really kind of need to think about, right? That's something that's discussed closer to the 5-yard line. So I think, my parents always made sure that I was never alone when I was doing my CF care. And that's really kind of the number one piece of advice that I give to CF parents more broadly.
Gotcha. All right. Very good. Now, I know you're really involved in, cystic fibrosis, everything that's going on. Can you kind of just tell our listeners now what future treatments in CF care are you really most excited about? Just kind of share that with the listeners.
So the Trikafta is a small molecule drug, meaning it's a pill that we take, which is really the best thing about it. Right? It's
absolutely
super easy drug. The unfortunate side of the medicine is that about 10% of the CF population cannot take Trikafta, and it has to do with some of the nuances of what CF looks like. For me, it's basically it manifests in dysfunctional protein that leads to this whole issue of CF that we've been talking about. For about 10% of the CF population that have two combinations of rare mutations, or certain combination of rare mutations, they actually don't even have CFTR protein, and they don't develop CFTR protein.
Okay.
So it manifests as cystic fibrosis in all the same ways. There's just no protein for the medicine to correct.
Right.
So these folks, unfortunately, still deal with the very classical cystic fibrosis symptoms. And it's really kind of one of the cruelest parts of CF that there is. So the next generation of CF care is really going to be reliant on gene therapies, gene editing, and sort of basically turning the body into a protein maker for these folks who don't produce CFTR protein with viral vector gene therapies that will hopefully one day create functional CFTR protein for everyone with CF. So that's kind of like the next horizon, I think. And I think we're sort of in the dawn of gene therapies, right? I mean, you see, it feels like every month now the new one gets approved, which is just awesome for these single gene genetic conditions. So
CRISPR and all this stuff is coming out.
CF is really a wonderful candidate to be on that line, and we're fortunate that there's a number of biopharma companies that are early preclinical stages of gene therapy development. So we've got our fingers crossed, and but we've got a number of clinical trials ahead of us that we'll have to watch, and we need people to participate in clinical research, right? They got to get out there, and it's the only way to move the needle forward.
No, it's awesome. And I just want you and your dad obviously have done such an excellent job with cystic fibrosis and advocacy. So, I just wanted you to tell us more about the Gunnar Esiason Foundation and how our listeners can, support the foundation and get more involved, because like I said from the beginning, I've been following you guys. It's you guys, especially in the Tri-County area, the Tri-State area, it's just an awesome foundation. So just tell us more about it.
Yeah. So the foundation was founded in '93 when I was born, and to date we've raised about $170 million in the fight against cystic fibrosis, which has been really awesome. And we've sort of seen CF care evolve sort of throughout my own life even. And these days we're really kind of focused on, of course, contributing to research towards a cure and supporting clinical care efforts. We support a number of clinics sort of throughout the tri-state area and throughout the country. But also we want to make sure that, CF, people with CF are able to have the resources they need as they age now. So this past year, we started our first IVF assistance grant where we will cover the cost of people with IVF for people with CF. We've partnered with a fertility clinic called Kindbody. They have a network of clinics all across the country. They've been a wonderful partner. Our goal, I think, is to expand the network by increasing the number of partnerships that we're able to develop around the country. But one thing, we learned, my wife and I learned as we were going through IVF, is how expensive it can be. And again, my wife and I were so fortunate that we were able to afford it. So we want to make sure that other people with CF have the same opportunities that we had in family building. And then, beyond that, we also provide financial resources for people with CF that are going through college, through college scholarships. We do advocacy work. We also do provide emergency funding for people that are either victims of catastrophic emergencies or natural disasters. So whatever we can do to make sure that the people with CF have a little bit less stress in their lives is something that we're really out to help with. And you can learn about the foundation at esiason.org.
Amazing. Well, Gunnar, we can't thank you enough for all your, sharing your experiences, literally from essentially when you were born all the way up through everything that you've gone through. It's really been an amazing journey, and thank you so much for sharing it, because our listeners are going to really benefit from that.
Yeah, for sure, man. Just also, where can our listeners find you? How can they follow you, and follow your journey and your experiences?
So I'm active on Twitter, on Instagram. My website's GunnarEsiason.com. I think my social media feed these days is mostly filled with pictures, I think, of our son. So I've made the full circle transition, I think, from like young adult to now parent, which has been fun, which has really been awesome.
I'm a 35-year-old young adult. Kevin has 2 kids, so I'll get there eventually, but not yet.
at least you won't need a search and rescue mission here next.
Yeah. Well, that's as far as I know. But yeah, this was great. Thank you so much for coming on, and thanks to our listeners as always for listening. Any questions, comments, concerns, you could always reach out to us. Through our socials. At the Man Up Pod is on Instagram, Twitter, TikTok. You can also follow Kevin and I, Kevin Chu, MD, and Justin Dubin, MD. Listen to our podcast. It's on Spotify, iTunes, Amazon. Subscribe, give us a review, 5 stars. Always really appreciated. For Kevin and I and Gunnar, thanks for listening. Until next time, have a good one.